Hello all. It looks like we just lost a couple people, but I'll give a slight introduction. So I'm Patrick. I am an adventure facilitator at the Outdoor Recreation Center at WSU, and I'll be one of the people helping to facilitate this little webinar. Looks like we got everyone back now. So as I was saying, I'm Patrick. Liz, Elizabeth will be my other co-facilitator. Welcome. We're going to be going over wilderness first aid and just some basic skills and basic preparation on how to be prepared and how to deal with yourself and others you're traveling with in an emergency. I am a certified wilderness first responder along with CPR and first aid through the American Red Cross.
And I'm Liz. I'm wilderness first aid trained. I'm also an adventure facilitator and CPR and AED and all that good stuff, first aid trained through for Red Cross as well. Okay, to get started, we're gonna do a little icebreaker. If one more thing, if you, I don't know who heard this and who didn't, but if you work for UREC, please send me a private message with your name, because that's how we'll be taking attendance if you work for UREC. But I'm gonna go ahead and we're just gonna kind of do like a get to know you kind of thing. So at the top of your screen, let me know if you can't find any of these things that I'm talking about. But at the top of your screen, you should see that I'm sharing my page, and there should be a drop-down button that says View Options, and then there should be a button to annotate, and you should see a button that says Stamp, and then you should be able to put stamps kind of anywhere on this page. And then don't worry about like clearing it or anything. I can clear the whole page. So we're just going to kind of start off with everybody doing a stamp where they're from. So you can be like where you're born, where you are right now. How many people do we have here? 1, 2, 3, 4.
You want me to go first?
10. Sure, yeah. If you feel comfortable, sharing where you're from, you're more than welcome to.
All right. Well, hello everyone. My name is Jay. I was actually born in Pullman, but like I was raised in South Dakota, so put like a stamp there, and because I'm from Rapid City, and then I came back to Pullman. That's it. That's my small life story. Yeah.
Thanks, Jay. Does anybody else want to go? You're not inclined to or anything, but if you want to, you can. Okay, I'll go. I'm Liz. I'm from Mebane, North Carolina, which is a really, not really tiny, but a small town like right in the middle of North Carolina.
And I'm Patrick. I am from Moscow, Idaho, so right next to Pullman. So yeah, local to around here.
Yep.
And it looks like most people are from the west side.
Hi everyone. Well, I cannot point on the map. I don't know why. But well, my name is Brianna Perez. I live in Wenatchee, 3 hours from Pullman. But I'm from Mexico.
Nice. So welcome everyone again to Backcountry First Aid. I am Patrick, and Liz is our other facilitator. So this is just going to be teaching you about the basics of some first aid steps on how to do minor injuries, but also recognize some more major injuries and how to care for them. This webinar does not substitute for a formal certification from a licensed organization or trainer. And so just because you're doing this does not mean you actually have a license to practice first aid. And so that's just good to know and good to remember. And next time I'm going to talk about the Good Samaritan Law. So the Good Samaritan Law will protect people from legal ramifications when they're helping someone during emergency, and they're not expected to be compensated, so it's not like a doctor who you pay. And so if you help in a way that is other people who are in a similar situation would also help as, you would not be considered negligent or reckless. And so you are able to help someone with this information as long as it's something you feel that you know how to do.
The good thing about the Good Samaritan law is that it can't be outside of your scope of training. So like, you're not going to want to do like, you know, try and reinflate somebody's lungs if you've only like taken like a basic first aid class. It protects you under what you like, your certifications and your knowledge at the moment.
Yeah, correct. Sorry. Then I'll go over the basics of what we're going to cover. So first we're going to talk about leave no trace, specifically planning ahead and prepare. So leave no trace is a set of principles that focus on minimizing your impact in the backcountry, and plan ahead and prepare is the one that's most applicable to first aid, because if you are planning ahead and preparing, you will minimize your chance of an injury and also be ready with the correct supplies if someone in your group or if you do get injured. Next, we're talking about basic cuts and scrapes, about some blisters, a little bit about muscle cramps and sprains and strains, also about the abdomen and stomach. It's really difficult to diagnose stuff there, but we will go briefly into that. Also talking about patient assessment, and also going into emergencies such as the one that are seen here. And so provide a kind of a broad overview, but not really go too much in depth. And at the end, there will be time for questions if you have something you experienced, or if there's just something you are wondering about. And we're not experts in any way, shape, or form, but we'll do the best to answer your questions.
So L&T, I don't know how many people have heard of L&T, but it's like Patrick said, leave no trace, and it's about minimizing your impact on the environment so that other people can experience the things that you've experienced in the outdoors. So like, you know, you see a really cool rock, like you're going to want to like leave it there so that other people can experience it. And in terms of by planning ahead and preparing, by like checking figuring out what you would need, what kind of terrain there's going to be, any risk associated with wildlife, you're going to really minimize your risk in actually needing emergency services or just, you know, getting hurt in general. Because when you aren't prepared and you go out and, you know, you get injured, if you need a rescue, that puts a lot of strain on the environment. So just making sure that you know everything you could possibly know about the area that you're going to before you go out. And bringing a first aid kit is kind of always a must, even if it's a minimal one for a day hike. The next couple of slides are about wounds. So for minor cuts and scrapes, you just want to make sure that you clean out the wound, you know, removing dirt, or if there's anything in there, depending on how big the scrape is, you just want to get that out before you cover it. And you can cover with antibiotic gel. It's not like a necessity. Mostly getting and keeping it clean is the most important. And you'll want to change, and you can just put like a Band-Aid on it. It doesn't require like a whole bunch of gauze or anything like that, depending on how big it is. And you do want to keep it covered to keep it away from environmental factors and to keep it from getting other things into it. And then a puncture wound. So if you get something sticking out of your body, like a twig or something, you fall on a twig, you want to leave it in the body because you don't know what it's like pressing on or what it's affecting. And unless it's obstructing your breathing, there's no real reason to take it out. So clean this bandage, kind of wrap around it to try and keep it stable too, because you don't want it moving too much, because it could be damaging things if it's moving inside. And that would be a hike out situation because you can't just walk around with a twig in your arm. That's kind of crazy. Oh, blisters, my favorite. So with a blister, it may not seem like a really big deal, but you want to stop and start taking care of it as soon as you feel discomfort. So maybe even before a blister forms, because especially if they're on your feet, because you'll be walking around in like socks and shoes all day and it's not breathing, and you don't want it to rub with, you know, whatever in your socks and all that stuff, especially if you only brought like one pair of socks. It's kind of gross. But you would treat it just like you would any other wound. You want to make sure you keep it clean and try to make sure that you don't pop it. If you do, treat it like you would a scrape. But you will want to kind of pad around it, so that you've got some area so that it doesn't pop. For burns, obviously you want to like stop the burning, and you can do this by like dousing it in cold water, or if you have an instant ice pack in your first aid kit, you could use that as well. And then you'll want to make sure you clean it off and wrap loosely with gauze. You don't want to wrap it too tight because you don't want to pull that burnt skin off. You want to keep it on there. If you ever have skin like hanging off, which is not like, I've never experienced that, so for me it's not super common, but if you do, you want to leave it attached. You don't want to take it off. And there's just like, for muscular injuries, like a sprain, or, you know, you like sprain your wrist or something. We have high rises. So you want to make sure you're hydrated, because water is always a good option. And then you want to rest whatever's hurt. Ice 20 minutes on, 20 minutes off, if that's available. If not, you could always just like, depending on like what it is and your availability to it, you could stick it in a stream. Those are usually pretty cool. And then compress. So like if you have an elastic bandage, you can wrap it in there. This is just to try and help keep swelling down. And then you'll want to elevate it above your heart. This will also help keep the swelling down, and then stabilizing it. So if it's a serious injury, you'll want to try and stabilize it as you hike out. But you know, if it's just a sprain, you'll kind of want to make sure maybe you'll use 2 hiking poles and a loose elastic bandage at night in your sleeping bag, just to keep it from moving around too much. Are there any questions so far about any of that? No.
I'll add
Okay.
something if people are thinking about their questions. So this is a piece of moleskin.
Yes.
I don't know how well you can see that in my camera. But so if you have a blister, you want to get some scissors out, and then you can cut around the moleskin to, as seen in the photo, to where it's just like a donut around the blister. And so you want to protect, you don't want to put the moleskin over the blister, because that's going to put more pressure. The moleskin will just allow the area around it to be elevated, and hopefully make it so the blister is not rubbing as forcefully on on whatever, like your shoe normally, or what it is.
Yeah.
Yes, Jay, do you have a question?
Yes. I was wondering, do you guys, so like, when we're doing like extreme hiking, do you guys know like, what are some tips to like, you know, prevent blisters on your feet? Like, I know very well, like, you know, you have to like, you know, build up your feet, but like, how do you do that? Or like, you know, like that kind of stuff. I hope I'm not getting too ahead, but I was just
That's
wondering.
a great question.
Mm-hmm.
So yeah, so to prevent blisters, it's a good thing to make sure you always wear in whatever boots you're going to use before you go for a hike. So if you bought new hiking boots, go for short walks, you know, around campus, around your neighborhood, for like multiple weeks, using it maybe only for like an hour each time, or like a mile or 2 in distance, and then slowly work your way up to doing longer hikes in the boots. It can also be helpful to wear 2 pairs of socks.
You have 4 slides.
And then also duct tape can be useful.
There's also such things called hot spots, and that's when you feel like your skin is already like rubbing. You don't quite have a blister yet, but you could have one soon, and stopping and even being proactive and putting some moleskin or tape or something on that spot wherever it's rubbing will also help prevent blisters. It won't it's not like a fail safe, but it will reduce your risk of getting one. Does that kind of answer your question, Jay?
Yep. Perfect. Yeah.
Okay.
It does. I mean, I actually heard of something really, really crazy. And that one crazy thing I heard was to put lots of lotion on your foot and then walk. But I mean, yeah, I wasn't so sure.
I wouldn't recommend that.
Yeah, I know I wouldn't do it either. That's the thing.
Yeah, interesting idea.
Mm-hmm.
And so then this is just like a piece of thicker gauze.
I mean, yeah, I'm not sure about the science behind.
Neither am I. That was just one thing that I was confused about. But yeah,
okay,
that was my question. That's it.
Right.
Before we talk about patient assessment, so one last thing. So this is a piece of gauze, and so this can be useful for burns or other injuries that are a little bit larger than like a Band-Aid. And so you can just apply this with some sort of tape to the wound with pressure as another form of protection. Mm-hmm. And it's always best to keep the wound covered whenever you're out, as Liz said, because it prevents infection.
I guess one of the things is, well, you guys can see this, but this is like tape, and it doesn't stick to your skin, but it sticks to itself. And this is a good way to, if you have a gauze pad or something, for blisters or for a wound, it's really good to keep it. I always keep a roll of this in my first aid kit just in case.
So next we're going to talk about patient assessment. So this is when it's not always applicable because a lot of times you're going to be hiking with someone when you're working or when they get injured, but it's also important just to have this these steps in your mind, and this is a good way to really assess a scene and to put your resources to the most effective way. So the first thing you do when you get there is assess the general scene safety and form a general impression. So how many people are injured? Was it like a rock fall? Was it a car crash? Was it someone just fell and twisted their ankle? Maybe they are dehydrated. Is it cold? Is it warm? Just what are plausible causes of someone to be injured? But also you want to make sure that the scene is safe. So only approach a scene with people who are injured if you know that you're not going to get injured when you're out there. So if there was a rock fall or something, wait till that's finished before you venture out into a more dangerous area. And so the first one is all about safety, as I've already been talking about. I mean, you want to protect yourself, because if you get injured, then you cannot help anyone else. So the most important thing is to protect yourself. The next step is what happened to you. And that's about seeing what their initial cause of injury was. And then after that, make sure you have PPE. So, gloves are a great thing to have in whatever first aid kit you're traveling with. You never know what that person may be like, or if they might have something that you don't want to have. Blood especially can carry different pathogens. And so make sure that you have the appropriate personal protection equipment. Normally for wilderness settings, we say just bring gloves. If it's really bad, maybe wear a raincoat and or sunglasses. Sunglasses can protect your eyes, and a raincoat can kind of protect you from other bodily fluids that may be around. The fourth one is see if there's other people that are also injured. And so with that, ask the person if there are other injured people and if they know where they are. Maybe you can see other people around. And if someone is in more critical condition, you want to go help them than the person who maybe just has a sprained ankle. And then lastly, you want to see if they are alive, and hopefully they are alive, but that's one of the first things you would check for. And if they are awake and alert, ask for consent. before you help them. So that's just a really good protocol to make sure that they acknowledge that you are there and willing to help them, and that they consent to having your help. And so you don't want to help someone if they don't want your help. You can offer some, do it in a kind way, and don't push them into accepting, but if they are in substantial need, maybe more strongly suggest it. But if they say no, then, and they are awake and alert, that's what you kind of want to do. And then looking on the right-hand side of the screen, the pocket guide. So that's kind of just what I was talking about. So the patient assessment is the PAS triangle, and then looking at scene size up. So what is like at the scene, life threats, which I'll go into now.
I just wanted, can I add one thing real quick?
Go ahead.
Sorry. If somebody is unconscious, you have automatic consent. So a little like odd, but if somebody really needs help and they're refusing help, if they go unconscious, it doesn't matter what they've said before, you can help them once they go unconscious.
That's correct. Yeah, good point, Liz. And now, so patient assessment. So the first things you want to look at when you are talking with a person and meeting them is make sure that their airway and they're able to breathe. Because without being able to breathe, then you die. It's kind of the way it is. And so making sure that their airways open and empty, that they're able to breathe and it's not painful. Also making sure that there is circulation. So is there a large pool of blood that the person is lying in? That would indicate that there maybe was a big wound. Or is there blood like in the person's clothing? Also not good. Decision on disability. So this is focused around the head, neck, and spine. So head, neck, and spine. And so did the person have a big fall? And if so, maybe don't move them because you might end up hurting their spine more. And then you can also ask the person, does your spine hurt? Or does your head hurt? That's another great way. And then after that, you want to go into the E, which is expose and treat the injuries. And so that's kind of our basic overview of the patient assessment. There's different aspects in this that we can go into if you have more questions, but we just want to give you a brief overview of how that works. And so if there is a life threat, so that's something that affects their A, B, C, or D, airway, breathing, decision on disability, or the spine, or the environment, you want to immediately seek treatment, either evacuate or rescue. So you want to get out of there as quickly as you can. Maybe if it's not as severe, it's just like a sprained ankle, you can monitor the person, and that's kind of the secondary assessment that we are not really going to go into right now. We're going to continue, and Liz will take over again.
Yes. Okay. So for severe bleeding, obviously this is life-threatening. This person could be bleeding out. And this is definitely an evac situation if you can't get the severe bleeding. I'm sorry, not evac, rescue. So there's two types of like evacuation. There's an evacuation where you can get up, you can hike out, or somebody can help you hike out. And then there's a rescue where people actually like come in and get you. So severe bleeding, depending on how bad and severe it is, could either be an evacuation or a rescue. If you can get the bleeding under control enough to hike out and have medical personnel meet you at like the head of the trail or halfway in or something, that would be kind of ideal. So the basic treatment for severe bleeding would be to apply direct pressure at the source of the bleeding with like clean gauze pads. And so I'm going to kind of demonstrate it roughly. Actually, I have a person that an assistant, as you will. Okay, so what you would do for bleeding is, so let's say she's bleeding on her arm. You're going to want to raise her arm, and you're going to want to apply a gauze pad. And if the bleeding doesn't stop or it bleeds through the gauze pad, don't remove the gauze pad because you could stop whatever clotting has already started. You just want to go ahead and add more gauze to it. And you want to keep doing that until it's stopped. And then once it's stopped, you can go ahead and wrap it, because you don't want to remove it, just like that. And then you'll want to, if you can't get it controlled, then you would apply a tourniquet. And like it says, tourniquets, it's this belt looking thing. So you basically, I don't have a tourniquet, but you connect the two like a belt, and then you strap it down, and then there is like a bar that you twist, and that tightens it. And once you want to apply the time that you applied it, because that will help rescuers and whatever they need to know that information for. And you don't want to take it off. At least in my training, I've been told not to apply a tourniquet, or not to take off a tourniquet once it's applied. Okay, could you go to the next slide, Patrick? Awesome. So musculoskeletal injuries, this is like sprains, breaks, fractures, anything that causes instability or inusability for a limb. So you want to see if it's acute or chronic. So did it happen because they fell off the cliff, or did it happen because they've got shin splints? So that could also be a question that you ask them, like, do you have pain usually when you're hiking, or is this like a new thing, or is it apparent that they twisted their ankle falling over a rock? And this is something that you can check for in your patient assessment. So then you want to assess for stability, my bad. And that would look like you maneuvering the limb. So if you have a foot, maybe you're going back and forth and side to side. It might hurt, but you want to see how much they can move it. And then you want to see how much they can move it on their own. And then you want to see, can they put pressure on it, or is there exposed bone and maybe they shouldn't put pressure on it. You'll definitely want to check for circulation, especially if it's a fracture, because you want to make sure that blood is getting to this injured limb. If it's not, that is definitely a rescue. That's a rescue injury, because they could lose that limb if it doesn't get blood. And then if it's just like a minor sprain, that RICE that we were talking about, hydrate, rest, immobilize, cold, and elevation, and stabilization. So if you have an unstable injury, so maybe somebody fell and they fractured their femur, you'll want to, if you see the picture, I'm sure it's something with his whole leg, and you want to make sure that it's completely protected, it's comfortable for the person, so that they are, because they're going to be probably staying in this for a while, depending on how long it takes you to get rescued or to hike out. But you want it to be compact. You also want to make sure that, if maybe they are able to walk on it, that you leave. If you're getting rescued, it's not that big of an issue, but if you're walking out, you'll need to make sure they can still put on a shoe, and can still move it enough to hike out. You want to make sure you're not cutting off their circulation enough, and that you don't want to do it on joints. You don't want to do it like right up on the knee. You want to do it like either above or below. That'll just make it more comfortable for the person. So now I'm just going to do like a makeshift splint of a foot. Assuming somebody maybe injured their shin or something. And it's going to be with things that I already have. So things that I usually take with me, like I usually have a notebook. I've got a trekking pole and some tent poles. I've got some cord, and I've got some just like, I have a sleeping pad, and I just have some other layers like sleeping layers and such that I always take to, and this is, the layers are just kind of to be for comfort. So I will bring you over.
And so the main thing is with splinting is the practice. And so it's a little difficult to realize how to splint someone, especially with kind of the impromptu gear that you normally have, such as Liz is demonstrating. So it is good to practice with your roommates or friends, maybe before you go out, on what you would do with the gear that you're carrying to help someone. Jay, do you have a question?
Yes, sir, Patrick. I was like wondering, like, will you guys also go into more detail in this lecture on like how to build our own medical kits? Yeah.
Yes, at the end of the presentation, we have a whole slide about that. So just wait.
Perfect. Thanks, man.
So this might be a little hard to see, but so I'm assuming she has a ankle fracture. She won't be walking on it. And so what I'm using is I'm using a hiking pole, and I'm using tent poles to stabilize her leg on the left and the right. And then I'm using a sleeping pad to kind of go around the foot to hold the hiking pole and the tent poles in place, and to also hold her foot at the right angle. And then I'm going under the pad with, I'm going under the pad with a, okay, yeah, that works. With NRS straps, which are basically just straps that cinch. You can use P cord, you can use basically anything you have on you. And then it's important to ask your patient how it feels. How does your splint feel?
Feels great.
Or is there any discomfort? Like, can you still, like, do you feel any tingleness or any tightness or anything?
I think it feels like a good tightness.
Yeah, does it feel pretty stable? Like, could you like walk it around and hurt it more?
I think it feels pretty stable.
Okay.
It's secure.
Awesome. Cool.
More secure than
Thank you. Okay. So that was kind of a bad, but this is kind of the end result of the splint. And then you'll want to readjust kind of if, you know, they start to, thank you. You'll want to readjust if they complain about discomfort, and making sure it's kind of, for hands, you'll want to be able to get to the fingers, and for feet, you'll want to be able to get to the toes, so that you can check for circulation, just to make sure that blood is still going through to everything. So yeah, sorry, that was kind of, that was kind of like a hot and fast splint. So does anybody have any questions about that? It might have been hard to see some of the steps. Yeah, this is like what would be one for an arm. Oh, there's also one for a foot.
So the SAM splint is what this orange and like light blue splint is. You can see in the center and lower right photos. And the SAM splint is just a piece of aluminum that has foam on either side of it. And that's really great for splinting. It can be bent into all different types of shapes. As you can see, it can be used for the knee in the center photo, for the arm or wrist in the other one. You use it for your elbow and have it go on your upper and your lower arm. So there's lots of different options for that. And so if you are working on building out your first aid kit, that's a really great thing to have. Really versatile in many different applications, and also really lightweight, and it's just a great thing to carry around. So next, I'm going to talk a little bit about head, neck, and spinal injuries. And so I'll first talk about like the signs and symptoms and then the treatment. So for your spine and neck, you might feel pain or tenderness. There might be impaired sensations, respiratory distress, loss of bladder and or bowel control, and or signs of shock. So many different symptoms, but often the person will know they were maybe hit in the spine or neck, or they fell and there's a probable cause. And so the main thing you want to do is stabilize the head, manage the airway and breathing. And if you're here, you want to evacuate as soon as possible. That person's is in severe pain probably, and also you don't want to move their spine or neck any more than you have to. And so often if there was a rescue, the person would not be walking out, they'd often be going out on a backboard. So that's a solid piece of plastic, or normally plastic or metal, that the person is carried out on. And so you want to just be really careful with the person and move them as little as possible, and also tell them not to move. You don't want to immobilize them, especially right after it happens. That might be more painful than the patient, and it doesn't really provide as much benefit. For the head, if you're hit in the head or have some injury to the head, you can also change your level of responsiveness. So you might not be able to fully comprehend where you are, what just happened. Maybe you blacked out for a second. You might have nausea and or vomiting. You might have headaches, memory loss, or sensitivity to light, or your eyes may have blurred vision. So with all of these, if it's not as severe, you want to have the person take it easy. Don't expose them to lots of noise, screams. But if it is severe, you want to evacuate. Head injuries are really something you need to watch out for. And in a lot of sports, especially faster moving ones, mountain biking, skiing, snowmobiling, head injuries are relatively common. And so you want to really watch out and make sure if they do happen, you get out and can evacuate as soon as possible. Next, I'm going to talk about snake bites. So snake bites are dangerous, although death is very rare. So unless you're much younger and or much smaller, so you have a smaller body, the chance of you dying is pretty rare. The main thing is you want to minimize your chance of encountering a snake. And so that can be using hiking poles when you're hiking. So if you do encounter a snake and it is going to attack you, you're able to defend yourself with the hiking poles, but also use them to push away maybe tall grass that would be in your path while you're hiking. So the signs of a snake bite, obviously there was a snake and you saw it biting someone, pretty obvious, but maybe it didn't happen. Maybe you came across someone and they're like, yeah, I'm just not feeling well. Maybe they feel a pain in their arm or their leg, but they don't really know what it came from. And so maybe it wasn't a snake. It could have been a spider or some other hemotoxin, which normally comes from animals such that. And so look out for where the incision or wherever the bite happened. There's normally some marks, often some localized swelling around that, weakness, sweating, and chills of the person, and also there can be numbness. So, as I said before, the main thing is to be prepared and have good prevention. Watch out for where you think there might be snakes. Snakes love the drier canyons to the south of us. And they also like to sun themselves on rocks, and they can also hide in little cracks or holes in the rocks. So, don't stick your hand into some random hole. That's not a good idea. So if someone was bit, get them to safety. So get the snake out of there and make sure that they're safe and in a safe location. Call the victim and note the time, because that'll tell you how long the venom has been in the person. You're probably going to have to evacuate the person. So keep that in mind and plan ahead on how you would do that and how you may contact emergency response, or know how you and your team would get out. You want to remove constricting jewelry and or other things that are really tight, because as normally it's a limb, your foot arm or leg. Swells, if you have jewelry like a ring or maybe like a tight wristband or something, that could limit blood flow because of the swelling. Next, you want to wash the surface of the wound because that will get rid of if there's any venom left on the surface. You can immobilize the limb to help manage the pain. You know, it's still going to be very painful, and there's not really much you can do in the field to help the person. You don't want to pressure wrap it. Putting pressure will only make the pain increase. Don't use ice, and so for that reason, don't use ice. And also don't use tourniquets because you don't want to put pressure on it. And if you are considering pain meds, don't use aspirin because it's an anticoagulant and is a blood thinner. So that's kind of snake bites. Make sure the biggest thing is just try to avoid snakes. And if you do see one, walk a wide way around it. So maybe 10 feet, 20 feet from where the snake is. Snakes don't want to bite you. It's only if they feel threatened that they will bite you. And that's true for most animals. Most animals don't want to injure you or hurt you unless they are maybe like rabid or, you know, there's some mental problem. So if you, you know, do your best to give them a wide distance, social distancing, which we're all learning now, right? They'll leave you alone and you can all go about your day in a happy manner. I'll briefly talk about environmental illnesses. So hypothermia. Hypothermia is really, it's not common, but it's something you can be worried about when you're in mountain environments or in cold water, such as if you are kayaking or canoeing on a lake or a river, or also maybe you are skiing up at the ski area, or maybe in backcountry, so not at a ski area, or hiking or biking in rain or other cold temperatures. So hypothermia, it can impair your motor skills, it can make you shiver, you can have slurred speech, the umbles, because you stumble and mumble. If it's moderate, so it's definitely more severe, you have uncontrolled shivering. And then that's where you start to have altered mental status. And then at severe hypothermia, you're no longer shivering, you are declining mental status to unresponsive, and that's when, if action is not taken, you could die. So for mild hypothermia, you want to reduce exposure, so find a warm place. If the person has wet clothes, dries, person with heat packs, hot water, anything that you can use to warm up the person. If it's very minor hypothermia, get the person to move and get calories into the system. But if they are even like like midway of mild or more severe, movement is not going to help warm them up. And so you just want to get them into a warm environment as fast as you can. But definitely if you are able to, giving them warm liquid tea, hot cocoa, and calories, so something with fat and sugar, helps a lot, and that will allow their body to start processing it.
Peanut butter is a really, really good, it's got fat, carbs, and protein, and it starts digesting fairly fast. It's a really, I always take a jar with me no matter where I go, like in the backcountry, so that's a really easy, like just small spoonfuls of peanut butter.
Yeah, that's good to know. And then also if the person has moderate to severe hypothermia, so these are people who cannot stop shivering, who have altered mental status and just, they're not in a good place. You want to get them warm. There's a hypothermia wrap, which I'm not going to go over, but it's just wrapping the person in a bunch of layers. And you want to get them out of that situation as fast as possible. They're not going to be walking, and they're probably not going to be drinking or eating anything unless they are able to do so by themselves. If it's severe, like I said, you just want to evacuate them. Do not attempt CPR unless they do not have a pulse. Often when you are in hypothermia, your pulse gets very reduced due to the fact that you are almost frozen, or you're extremely cold. So only give CPR when you can confirm there's no pulse, because otherwise it'll do more damage than good.
So just a couple of other, I won't go too into detail about them. If you want to know more, you can ask questions, but like we said, we're not experts. But so with, you want to be careful with lightning and try to avoid it when possible, but it's not always, possible to avoid it. But it can do anything from like a small burn to creating severe brain damage or somebody going into cardiac arrest. So you just kind of want to, if somebody gets struck by lightning or you suspect that somebody has been struck by lightning, you'll want to basically go through your patient assessment and go from there. So, if they have altered states of consciousness, make note of that. If their heart has stopped, then you would want to perform CPR, but you want to make sure you get them to a safe spot first, and also only making sure that you can do so without hurting yourself. Because like Patrick said, if you are injured, then, and you're the only one who can help, then now there's nobody who can help. So you just want to make sure you're getting everybody to a safe environment first. And then with frostbite, this is when, limbs of your fingers, you're getting cold, you're not adequately prepared for the weather. Or maybe you have wet gloves, or maybe you have wet boots or like wet socks, and it's really cold. It's, your tips of your fingers start to go, the tips of your toes start to go. And it's because the blood is rushing towards your organs, and because it's like these are more important. At first, it'll start to be like painful, and then it'll start to kind of go numb and feel kind of waxy. An important thing about frostbite is that if you suspect that somebody has frostbite on a limb, you don't want to rewarm whatever is frostbitten unless you're certain that you can keep it unfrozen, because if it freezes and dethaws and freezes again, it will cause more damage. So if you're not certain that you can keep it unfrozen, go ahead, just don't do it, but try to prevent it from moving further. That'll do less damage in the end. For UTIs, there's really not much you can do about those in the backcountry, and that would be a hike out situation. You need to seek medical attention because you don't really carry antibiotics with you in the backcountry. And if you have pain in your abdomen, I guess it depends on, like what it's from. If it's from like menstrual cramps, I would say, if they're really unbearable, maybe hike out. But if it's in your right lower abdomen, and it's like sharp pain, it could be your appendix, and I would hike out. And if you start to somebody starts to develop more symptoms like altered states of consciousness, going into shock, I would call for a rescue because their appendix might have burst. And then stroke or heart attack, for either of those, you want to call for a rescue. If it's a heart attack, you can give them aspirin, which is a blood thinner. It's not going to solve the problem, but it'll help decrease it. As you can see, Patrick is holding up a bottle of aspirin. And you want to try and get them in a sitting position, because this is how they will be able to take in more oxygen. It's harder for them to do that laying down or standing up. And if they're having trouble, maybe help prop them up, especially if they're having a stroke. Part of their body might be weak. So helping them with that. For stroke, you also want to call for a rescue because you want to try and get that mitigated as in as short as time as possible to reverse the effects. Because stroke is basically time is your enemy. So the longer it happens, the more damage it's going to do.
So another thing to note about heart attacks, the symptoms in men and women can be very different. Men almost have, or mostly have, like just a pain in the chest and maybe some like tingling in their left arm. In women, they often don't have the pain in the chest. They might just have trouble breathing or much more general chest pain. So if someone does present with those symptoms, it is probable that they do have a heart attack or some heart-related injury, despite the fact of not having sharp pain in their chest. So you still want to give them aspirin and evacuate, even if it's not sharp pain in their chest.
Yeah. Giving aspirin giving most medicine like Benadryl or aspirin or ibuprofen really won't hurt as long as somebody's not bleeding out, or you know, they don't have problems with their liver, or there's no allergies. So, you know, when in doubt, if you're like, oh, this could be a heart attack, like that's serious, and the person will probably be more grateful to have taken that aspirin, even if it wasn't, than to have not and it was, if that makes sense. So now we're kind of moving back a little bit to environmental illnesses and into heat-related illnesses. So there's heat exhaustion, and then there's heat stroke. Heat stroke is kind of like elevated heat exhaustion. So with heat exhaustion, you might be feeling kind of nauseated or tired, maybe a little dizzy. You might have an elevated heart rate and breathing rate, and you might, you know, be kind of cool, but maybe you like have some like sweat on your forehead. But with a heat stroke, it's going to be much more serious. Heat exhaustion is a kind of sit down, drink some water, and relax until you cool down. Heat stroke is more of a, we need to cool this person down like right now, and get a rescue. So for a heat stroke, you're gonna have some of the same, really the only like same symptoms as an elevated heart rate and an elevated breathing rate, but your level of consciousness will change. So, you know, they might have an altered mental status. They might be like combative. So like they might be like, if you try to help them, they're like, don't touch me, like, but they're not in the right mind. It's okay. In that case, if you have somebody who's combative, just trying to talk with them, and just try and be like, I'm here to help. And, you know, maybe don't go straight in like, I'm CPR, first aid, can I help you? That might freak them out. So just kind of like going like, hey, like, hey, good. How are you? You know, what are you out doing today? That's helpful. You know, that gets people to be like, oh, you kind of build some rapport with them, and they're more likely to let you help them. They might have hallucinations, or they could possibly be seizing. That's a big one. You're going to notice that one. But they might have troubles with coordination or speech. You want to be sure that you check all of these symptoms with just like a regular stroke. Heat stroke is they're going to have a really, really high internal temperature. So keeping single-use thermometers or even a digital thermometer in your first aid kit could be nice if you're somewhere where there's a lot of hot weather. Okay, so and treatment for them. So like I said, for heat exhaustion, just kind of, you know, sit down, take a break, get in the shade, have some water, maybe have some like calories, some like dried fruit, so some like sugar that'll help bring your blood sugar back up, and protein following, so some dried fruit and some peanut butter. That's always a good one. And just make sure you're monitoring them closely, just to make sure that they're not getting worse. If they get worse, you need to call for a rescue. And then for heat stroke, if they have an altered mental status and you can get them to want you to help them, you want to aggressively cool them. So in the front country, so you know, somewhere like on a you know, at the park or at a ball game or something, you know, you could, you know, throw bags of, or not throw, no, don't throw. You could, you know, use bags of ice to try and cool them down. Water works pretty well. Like if you're near a stream, you know, honestly, trying to get them, you know, kind of down to not quite their underwear, but sort of, and getting them like into the river to cool down, that would help. Just make sure you're safe and that they are safe also. You can use a notebook to fan. This would be a rescue because there is, if they can walk, you can evacuate, but I wouldn't recommend it because, you know, they could pass out anytime or seize, or become worse mentally, and that's not something you want to deal with while you're hiking out. So that would be like a rescue case scenario.
So infections. Infections can happen from a whole host of different causes. It could be from maybe a plant. It could be from an animal. It could be you just cut yourself, just a small cut, but it got infected from, just bacteria that's around us. So you can notice an infection if there's redness or swelling from wherever the wound is. Often there is pus formation. And if it's very severe, there can be red streaks going up the arm, so towards your heart. And that's when you definitely need to evacuate or get some antibiotics or some other medication, because if that were to get worse, that could spread and go to the rest of your body and could be very bad. But often an infection is small and you're able to treat it maybe in the field or maybe just with a little bit of work. And so to treat it, you can hot soak it. And so that will allow you to clean the wound, but also maybe kill some of the bacteria. And after you're done soaking it, you want to clean it with clean water. You don't want to pack the wound dry and like really make it very, make it really tight, because then you might like force all the pus out or something. You want to just have a nice loosely bandaged wound and put more gauze instead of really dry gauze, and that'll help. Might make it more comfortable instead of having drier gauze. It would help with the healing process. If it is a severe infection, which is where you could see like the streaks going up your arm, that's called septic shock, and that's something where you would want to evacuate immediately. And then lastly, I want to talk about some medical conditions. So these are, relatively common, such as allergies, asthma, diabetes, and these are something that you want to look out for when you're traveling with people, either in your own group or if you come across someone who has a medical emergency. So if someone does have severe allergies and they carry an EpiPen, make sure they have it with them at all times whenever you are going out somewhere. An EpiPen can be a life-saving device. It will reverse an allergy or an anaphylactic shock. And it can also be used if someone has a big allergic reaction or has a severe asthma attack, as it will open up the airways. So to use one, basically you should only use one if the person is able to do so, but you're going to put it in the outside of their leg. And so if someone does have an EpiPen, make sure they are carrying it with them at all times. Or if they have asthma, make sure they carry their asthma inhaler with them at all times. You never know, maybe you're just going on a short 5-minute hike. They may get nervous for some reason and need their inhaler, or maybe there's like a snake there, or maybe there's a bee. A lot of people are allergic to bees. You never know. So make sure you're prepared in whatever way. And with diabetes, if someone has that, make sure that they are able to get the proper nutrients they need, and that might include snacking more than other people.
For people who carry EpiPens, make sure that the people that you're hiking with know where your EpiPen is in case of an emergency and you can't get to it.
Yeah, that's a good point. And also, before you go out on a trip, if you have one of these more severe medical conditions, talk about it as a group, and so people know, so that if something does happen, everyone is able to provide the best possible care. So a little preparation beforehand can lead to a lot more proactiveness and preparedness later on. And one other thing, just on a side note, so often if there isn't a bathroom around, you can use this. It's called toilet to go. It is a little pack that you can go to the bathroom in and carry it out. So that's like if you were, I don't know, in the desert Southwest where you're not supposed to be digging cat holes, or in somewhere else So that's just another little thing to mention and know. Next, I'm going to talk about the first aid kit. This is just an example list. This is not an extensive list, and nor should every list, you can start off with a smaller kit or start off with a bigger kit. So this is just kind of what we say you should have. So you want to have some gauze, you want to have adhesives. You also want to have triangular bandages. Those are really useful. Fingertip Band-Aids, they're nice to have, but if you're doing a backpacking trip, maybe you don't need to bring those. Trauma shears can be useful. So those are essentially heavy-duty scissors. Tweezers are very useful. I'd recommend those for all kits. Pocket masks are used for CPR. So if you need it, it can be very nice. Gloves are essential. A SAM splint can be very useful. So that's what I was talking about before. It's the aluminum to help with splinting. Athletic tape or duct tape, both very useful and can help with a myriad of different things beyond just medical. Ice packs and heat packs can be useful. Syringes can also be useful. A thermometer can be very nice when doing temperatures, especially if someone has heat exhaustion and or hypothermia. Triple antibiotic ointment is useful to preventing infections. Benadryl and some other useful medications include aspirin and ibuprofen. Yeah, Liz, do you have anything to add, or should I keep talking?
Yeah, no, I have a couple things to add. So you can either make your own first aid kit, or you can with just like a sack or a bag or something, or you can buy one. But I would recommend, if you do buy one, going through it, knowing what's in there, where it is, making sure you know how to use it, and adding things if you're like, I need this, and maybe taking out things you're like, oh, I don't necessarily need that. And then for medications, prescription and non-prescription, it'd be good to keep them in places where they won't get wet. You can keep them in like deep within your first aid kit, like deep in your bag, they probably won't get wet. Or you could use like if you're going like on a kayaking trip or something, you can keep them in a waterproof box. Like this is one version of one. I use it for my satellite messenger, but this is they have smaller ones, that are about this big, and putting medicine in there. Just some useful medicines just to like kind of have with you. Aspirin, ibuprofen, Benadryl, and Dymo, which is an anti-diarrheal. You don't think it's a big thing, but it's a big thing, especially if you're dehydrated. You don't want to be like losing that water, or pooping yourself on the trail. So it's kind of like which is having it is way better. And it's also called Dymo. Like it isn't even called like anti-diarrheal, so it's no one's gonna really know. So yeah, basically you want to just kind of like summary of that is you want to make sure you have what you need and it's where you need it to be, because you don't want to get in there and be like, oh, I don't have that. And just kind of keep it just specific to your needs, basically.
Yeah, and I want to reiterate, make sure you know how to use each item that you are carrying in your kit. So that may involve practicing and just knowing and understanding how it can be used. Yeah. Next, we're talking about further trainings. So the training that is offered through UREC is CPR, AED, and first aid training. Relatively basic first aid, but it's still good to learn. But CPR and AED is really important, and I cannot recommend enough knowing how to do that, because if the emergency arises, it can be life-saving to know how to use those skills. Yeah. And it's relatively cheap.
Yeah. In comparison to the wilderness first aid, of course.
So wilderness first aid, that's more of the industry standard and is also a great way to get prepared before going out into the backcountry. Their courses are 2 days long. There was supposed to be one delivered in the spring. It might be postponed now to August. I don't quite know, with Knowles at the ORC, but they're also around the country. There's ones in Seattle. There's some in Spokane, I know. And so keep your eye out if you're interested. A little expensive, but can be very, very beneficial and a great way to learn a lot, much more in depth than we go, about how to deal with emergencies, but you also get a lot of hands-on practice, which is fantastic. And then lastly, completed the Wilderness First Responder. So that's the next step above. So that was an 80-hour, 5-day course, much more in depth, a lot more difficult, but also I really enjoyed it. So yeah.
And then prices for these vary. So like, I know like ours is like 200. I don't like for Wilderness First Aid. I don't know where they are in other places. I'm sure you might be able to find one less expensive, and you definitely be able to find ones that are more expensive. And for Wilderness First Responder, I know they can range from like, you know, like $400 to like $1,000 and like more, depending on like kind of how fancy they are, where you do them, how long they are. So making sure like if like the cost is an issue, making sure seeing, you know, if sometimes like even U of I does some like classes, so like just making sure you're checking with like your local places first, because sometimes they can be a little bit cheaper because you don't have to do lodging, stuff like that, and then kind of, you know, branching out to see if there's some other ones. They are a little bit more costly, but they are worth it in the end to know these things, because I would not have known all these things had I not taken like the Wilderness First Aid course. So yeah. So that's kind of like, yeah, the end of our presentation. This would be the time for questions. You can, you know, chime in, you can chat it in, however you want to. Does anybody have any questions about like Wilderness First Aid courses offered here? Anything we went over, anything like that about the ORC in general? We can also answer questions about that.
I mean, anything? Do you want to know about anything else? I mean, we're here.
Yeah, it's like we're here for another like, yes, here's a question. Okay, so does the ORC have a lot of backpacking tents to rent? So I think we have 1, 2, 3, 4, 5. I think we have about 6 to rent, and they range from 2-person tents to 4-person tents. If you're looking to rent a backpacking tent, I would recommend doing it sooner rather than later, because we don't have as many of them, and they go kind of quick.
But the ORC is closed right now, so you cannot rent them right now. Or this,
yeah.
But next semester, or maybe during the summer.
Yeah, totally. Honestly, if it's in the summer, try sleeping out under a tarp or like nothing at all. That could be fun. Or in a hammock. You know, hammocking is fun too.
Really cool.
No, you get to feel like you're kind of like floating in the air, almost dying, but not really, but sleeping still. So it's a good mix. Well, if nobody has any more questions, that's kind of it. If you do think of questions afterwards, you could feel free to email us. It's just our first dot our last names at wsu.edu. And if it's not a question that we can answer, we can always direct you to someone who does know or find out the information for you. So just keep that in mind.
Yeah. Well,
okay.
Thank you for attending.
One more thing. Oh, sorry. I just want to make sure if you're UREC staff and you haven't given me your name, just do that real quick, because that's how we're taking attendance for UREC members. I'll give you guys like, I'll give you like 30 seconds to do that.
Before we kick you all out.
Yeah, before I'm like, Yes.
Thank you, guys.
Yeah,
Yes,
you're very
of course.
welcome.
Thank you. All
Have a
right.
safe evening.
Yes. All right. Well, everybody have a grand evening.